Welcome friends. Topic of today's video is gross anatomy of male urethra. Male urethra is a muscular tube for the external discharge of urine and semen in males. It is approximately 18 to 20 centimeters long. In the flaccid state, the male urethra is S-shaped. So in flaccid state, it is S-shaped, having two curvatures, the proximal curvature and a distal curvatures. So in flaccid state, it has two curvatures. But in erect condition or erect state, it is J-shaped, having only one curvature. This distal curvature gets obliterated and only the proximal curvature remains. So it becomes a J-shaped. Now the parts of the male urethra. If we see in this diagram, this is the urinary bladder, this is the prostate, this is the urogenital diaphragm consisting of superficial fascia and the inferior fascia commonly known as perineal membrane. In between these two fascia, there is two muscles, sphincter urethra and deep transverse perineum. This is the bulb of the penis, this is the body, and this is the glans of the penis. The male urethra can be divided into three parts. The prostatic part, which is traversing the prostate, the membranous part, which is surrounded by this urogenital diaphragm, and the spongy or the penile part, which is traversing the bulb and the corpus spongiosum of the penis. The part of the urethra which is starting from the neck of the bladder or from the internal urethral orifice from here till the level of the superficial fascia of urogenital diaphragm, which is traversing the prostate gland, is the prostatic part. Okay, this prostatic part of urethra is approximately 3 centimeters in length and it passes vertically downwards from the neck of the bladder more onto the anterior aspect as compared to the posterior aspect, or we can say at the junction of the anterior 1/3 and the posterior 2/3 of the prostate gland. If we take a transverse section of this prostatic urethra, the transverse section of prostatic urethra will look like a crescent or semi-lunar in shape with the concavity facing backwards. This prostatic urethra is the most widest and dilatable part of the male urethra. Now, what are the features of the posterior wall of this prostatic urethra? If we enlarge the diagram here, this is the prostatic urethra. At the posterior wall, middle part, there is a mucosal elevation which is known as urethral crest. On this urethral crest, there is also another swelling in the median plane which is known as colliculus seminalis, or also known as viru montana. On this colliculus seminalis lies three openings. In the center, there is opening of the prostatic utricle. This is the opening of prostatic utricle. The prostatic utricle is basically a homologous of uterus and vagina in the male, and it is a 6 centimeter blind sac extending backwards and upwards from the posterior wall of the prostatic urethra between the median lobe of the prostate and the posterior lobe of the prostate. So this is the prostatic utricle. Which is a homologous of uterus or vagina in males. Developmentally, it will represent the fused two ends of the Mullerian duct. Now, onto the sides of this prostatic utricle, on both these sides, lies two openings of ejaculatory duct. So these are the openings of the ejaculatory duct, which is basically a union of duct of the vas deferens and the seminal vesicle at the back of the prostate to form the ejaculatory duct, and this will open onto the sides of the prostatic utricle on the posterior wall of the prostatic urethra. So the colliculus seminalis will have three openings: a median opening of the prostatic utricle, and on the two sides of the prostatic utricle, two openings of the ejaculatory duct. Now, the space adjacent to the urethral crest on both the sides, this space is known as prostatic sinus. Prostatic sinus, these two spaces, into which opens small, numerous prostatic glands. Therefore, the small prostatic glands which are present in the prostate will open directly into the prostatic sinuses. So these were the features of the posterior wall of the prostatic urethra. Now the second part, or the membranous part of the urethra. The second part, or the membranous part of urethra, lies in the deep perineal pouch, which is between the superficial fascia of urogenital diaphragm and the inferior fascia of urogenital diaphragm, or the perineal membrane. So this part is known as membranous part, which is surrounded by the sphincter urethra muscles. This membranous part is approximately 1.5 to 2 centimeters in length, and it runs vertically downwards and slightly forwards. This membranous part is the second narrowest part or dilatable part after the external urethral orifice. The transverse section of membranous part is star-shaped or stellate-shaped. Now the third part, which is the spongy or penile part of the male urethra. This part is approximately 15 centimeters in length and comprises of two parts. First is the fixed part, which is present in the root or the bulb of the penis. This is the fixed part. This fixed part, after piercing the perineal membrane, runs forwards and upwards in the bulb of the penis, and at the lower border of the pubic symphysis bends downwards to continue as a free part of the spongy or penile urethra. This free part terminates at the level of the external urethral orifice or meatus. The penile urethra is approximately 6 millimeter in diameter and has two dilatation. At the commencement of the penile urethra, just after piercing the perineal membrane, you can see this dilatation. This dilatation is more onto the floor and to the sides of the penile urethra. This dilatation is known as intrabulbar fossa, which bulges onto the floor and to the sides of the penile urethra. Another dilatation is present at the termination of this penile urethra just before opening at the level of external urethral orifice. This dilatation is present in the roof of the penile urethra, and this dilatation is known as navicular fossa or terminal fossa. So the basic difference between these two fossa was that the intrabulbar fossa was bulging into the floor of this urethra, and the navicular fossa was bulging into the roof of the penile urethra. This external urethral orifice is the narrowest and the least dilatable part of the male urethra. So this is the narrowest. Now, if we take a transverse section at this level, that is the intrabulbar fossa, the lumen of the penile urethra will be of trapezoid shape. Also, if we take a transverse section at the level of the body of the penis, it will have a transverse slit lumen. Next, if we take a transverse section at the level of the base of the glans, the lumen will have a inverted T-like appearance. Lastly, if we take a transverse section at the external urethral orifice level, the lumen will have a vertical slit-like appearance. So we can see here that the lumen of the male urethra is irregular, which is converting from crescent shape to star shape to trapezoid shape to transverse slit to a inverted T shape to a lastly vertical slit-like appearance. This irregular lumen causes the projectile nature of the urinary flow. Next, what are the different sphincters of the urethra? There are two sphincters of urethra. First one is at the level of the neck of the bladder. This sphincter is known as sphincter vesicae or internal urethral sphincter. This sphincter vesicae is made up of longitudinal loops of smooth muscle fibers derived from the detrusor muscle, as well as some elastic and collagen fibers which is surrounding this neck of the bladder. This sphincter is involuntary in nature and is supplied by autonomic fibers. It is basically a functional sphincter rather than an anatomical sphincter. The second is the external urethral sphincter, present around the membranous urethra, which is composed of the sphincter urethral muscle, and this external urethral sphincter is voluntary in nature and is supplied by somatic nerves, that is perineal branches of the pudendal nerve. This external urethral sphincter is responsible for the voluntary holding of the urine. Now, 2 points to remember. First is what are the openings present in the membranous and the penile part of urethra. On the sides of the membranous urethra, in the deep perineal space or pouch, lies two glands, which is the bulbo-urethral glands. Okay, which is present in the deep perineal pouch but opens into the intrabulbar fossa. Next, there are small urethral glands present in the wall of the membranous urethra, which opens directly into the lumen of the membranous urethra. Also, in the wall of the penile urethra, there are also some small glands, urethral glands, which also open into the lumen of the penile urethra. These small glands are known as Litter's gland. In the wall of the penile urethra, there occurs small recesses or lacuna. These lacuna or recesses in the wall of the penile urethra are known as lacuna of Morgagni. And in the roof of this navicular fossa, there occurs a large lacuna. This large lacuna is known as lacuna magna. So, if we summarize it, what are the openings in the membranous urethra? Small urethral glands open into the membranous urethra. Openings in the penile urethra, opening of the bulbourethral glands, and opening of the small little glands, as well as presence of small lacuna of the Morgagni. Next point to remember. The prostatic part of the urethra as well as membranous part of the urethra are together called as posterior urethra. And this part, that is whole of the penile part, is together known as anterior urethra, which comprises of a fixed part and a free part. Now the lymphatic drainage of the male urethra. The posterior urethra drains mainly into the internal islet group of lymph nodes, and some few lymphatics can also drain into the external islet group of lymph nodes. Now the anterior urethra. The anterior urethra drains mainly into the de-inguinal group of lymph nodes, and few lymphatics can also drain into the superficial inguinal group of lymph nodes. These lymphatics which drain into the superficial inguinal group of lymph nodes is basically coming from the terminal part of the penile urethra, or the part near the external urethral orifice. Now the blood supply. The male urethra is supplied by 4 sets of arteries. First artery, the artery which is supplying this inferior surface of the urinary bladder, that is the inferior vesical artery. Second is the middle rectal artery. The third, which is the main artery of the perineal region, is the internal pudendal artery. And the fourth is a branch from the internal pudendal artery, is the artery to the bulb of the penis, which is supplying this part of the urethra, which is present in the bulb of the penis. So these 4 sets of arteries will be supplying the male urethra. Now the nerve supply. The male urethra is supplied by 3 sets of nerves. 2 are autonomic and 1 is somatic. The first is the sympathetic supply. This sympathetic supply is coming from preganglionic sympathetic fibers from L1 and L2. The parasympathetic supply will be through pelvic sphincter nerves, which has root value S2, S3 and S4, through the inferior hypogastric plexus. These two, sympathetic and the parasympathetic supplies, will supply mainly the internal urethral sphincter, which is basically involuntary in nature. And the third, that is the somatic nerve supply, will be supplied by the somatic nerve, that is the pudendal nerve, which has root value S2, S3 and S4, which will supply the striated muscle of the external urethral sphincter, which is voluntary in nature. The clinical anatomy related to the male urethra is that, first, to counter the curvatures of the male urethra during urinary catheterization, the penis is straightened out like this, so that this distal curvature is obliterated and the urinary catheter can easily pass into the penile urethra. Second is the extravasation of urine during various types of urethral injury, which I have already discussed in my previous video on extravasation of urine. Kindly go through it. So this is the gross anatomy of male urethra. Thank you very much.